Hello, good morning. I'm Dr. Peroy from Spain, from Lleida, and I wanted to present you this work we did, a multicentric study, alongside with our colleagues from Taulí, where we compared the treatment in situ fractures to know the mortality of them. I have no declaration of interest. I want to start with a clinical case. We have this 77-year-old lady that came to our emergency room with a fall from her own height, presenting neck pain with no neurological deficit. This is, I wanted to know the audience with a Slido to know what would you do with this CT scan where we can see this fracture. So if we can put the Slido, please. What would you prefer, do a surgery, a posterior fixation, maybe a conservative or orthopedic treatment with an allo jacket, or maybe a collar? I have to tell you that this lady lives on her own, she's independent, she's no big morbidities. Not really allo jacket fans here. Well, I can see that there is no consensus, if we can go on. There is no consensus on the audience. That's what we thought and what the sensation we had. So we wanted to know if what we were doing was the right thing to do. And we started this study with this hypothesis. We performed a retrospective multicentric descriptive studies. We collected data from our center and also from Taulí Hospital. And we selected patients with situ fractures over 65 years old during the years 2017 and 2022 who had at least 1 year follow-up. We collected this data, including demographical parameters, as well as medical parameters and also surgical parameters. We divided the patients in two groups, whether they were treated operatively with posterior instrumentation or odontoid screw, or conservative, or maybe we should say orthopedic treatment with the allo vest or collar. We had 69 patients included in our study. 71% of them were women. The mean age was around 82 years old, and type 2 fractures were the most common. The mean Charlson index was 2.3. As long as what refers to the groups, we have 31 patients in the conservative group and 34 patients in the surgical group. There were 4 patients that weren't treated because they didn't make it to the surgery. Both groups were comparably in age, sex, and Charlson index. When we come to the results, we can see that there is a significant higher hospital stay in the surgery group than in the non-operative group, and there is more complications, more medical complications in the non-operative group, even though this is not significant statistically. When we compare the mortality, we took 3 points. We took 3 cut points during the hospital stay at 3 months, at 1 year. We can see that there is always a significant higher mortality in the non-operative group than in the surgical group, with significance in all the cut points. So with this data, we can conclude that there is less mortality in surgical group at 1 year, but also at the other during all the year. But there is more hospital stay in this group. Maybe as a retrospective study, we have a selection bias because some patients were included directly to the complication group, whether because they weren't fit to be on the operation room. Although we didn't find more medical complications, and the Charlson was not different. And maybe other limitation we can have is that in the future we can separate the orthopedic group in between allo and collar to compare them, as has been recently done by EUROSPINE in a study months ago. So with our lady, we perform an allo. In my center, we are allo lovers, and we perform an allo. She had the allo for 2 months. We removed the allo, and 3 months now, the fracture is partially healed. She's just complaining about neck pain and a little stiffness, but the lady is doing fine. Thank you very much.